Hi everyone, this is the Scrutinizer aka Dr. Meenakshi Noor. So the chaos in America continues over COVID-19. Anti-masks, anti-vaxxers, schools reopening, are Americans anti-living is my question. The latest news is that the United States is in the lead with 54,000 daily new confirmed cases and at least 160,000 dead so far. And that includes children, adults of all ages, even athletes, and younger people with good immune system. Regardless, Americans have become anti science. They have made this pandemic into a political, personal, religious issue. We already had anti vaxxers to deal with, and now there are anti maskers, anti any precautions needed to keep people safe from the virus. Then there are these people who have an immune system. They flaunt their good immune system and don't need any precautions. If they knew the first thing about immune system, they won't be posting these images in the first place. Think about it. And right now, as the scrutinizer always says, critical thinking skills are required. So, if immune system was really enough to keep us safe from every disease, why would we have needed the need to spend so much money on research and discovery, that is antibiotics, vaccines, or dedicate an entire medical system towards infectious diseases? There should have never been a disease in a society. The question for today's topic is, considering all these above factors, do most Americans really want to suffer and die from the virus? Do they want to become a population of sick people? I say this because even the people who have recovered from coronavirus infection, they have really long-term health problems which keeps them dysfunctional in their everyday life. So thus overpowering the already seemingly non-existent public health system. Let's say these people do not really care about their own health or life, but what about other people? Or what about their own children's right to be healthy or grow up and enjoy the life as we once used to? And once used to is not that far away. It was like in November or December 2019. So all this great life and luxury was solely because of America's advancement in science. Science is what made this country a superpower, brought us the great life, power to eradicate most deadly diseases. However, do all these anti science Americans really want to put their children and the next generation in a situation to struggle and clean up the mess caused by their ignorance? And this is provided that next generation is healthy. In other words, making them reinvent the wheel. Hopefully, this can be avoided by understanding some scientific facts that I bring to you today. That is, we need to understand the reason we are asked to wear masks and practice social distancing. It all depends on the mode of transmission of the disease, which means how a particular infection spreads. For example, instead of this virus, if we were facing a cholera outbreak, so masked and social distancing would have done nothing to save our lives. Why is that? Let's think about it and use our critical thinking skills. It's because cholera is spread from drinking contaminated water. You do not get cholera just by being in presence of an infected person. Here the precautions would have been by the public health officials to clean the water, and maybe we would have been asked to boil the water before we drink it. Hopefully not, but maybe Americans would still have had an issue with boiling that water. Similarly, if we had an outbreak of malaria, once again, no masks or social distancing would have helped. And why? because you do not catch malaria by sitting next to a person who is suffering from malaria. You have to be bitten by the mosquito, and that also is a special mosquito, that's Plasmodium vivax or Plasmodium falciparum. And this brings me to the whole saga of treating COVID patients with hydroxyquinone, which is a wishful thinking, and this is an anti-malaria drug, but I'll cover that in a different video. So coming back to our pandemic and the issues at hand right now. The pandemic we are facing is caused by a novel influenza virus, which is a respiratory virus, which means you can definitely catch the disease from being just in the vicinity of an infected person, just like cough or flu, except those diseases are not really deadly, but COVID-19 is. In this case, in case of COVID-19, the viral particles are transmitted or spread from the infected people when they talk, breathe, cough, sneeze, etc. So these viral particles, they get encapsulated, meaning they get stuck or entangled in the globs of mucus, saliva, or water. Pretty gross, huh? Their fate or behavior depends on the size of these globs. So larger the glob, meaning they will fall faster than evaporating, thus splashing down nearby in the form of droplets. However, the smaller globs, they are more of a problem because they can drift further away than the droplets. They can evaporate faster and can linger in the air. That is, they can stay dormant until they find a suitable environment or a host and start reproducing, that is, causing infection. So this tells us that there are at least 3 modes by which coronavirus can be transmitted. Number 1, aerosol transmission. This explains the necessity of wearing the right kind of mask. Not just wearing a mask, but the right kind of mask in the right fashion. Secondly, the droplet transmission, which explains why social distancing is needed. 6 feet was taken as an arbitrary measure, considering what we thought is the size of the droplets, and now that distance is much farther than previously appreciated. It has become like 7 to 8 feet. However, once again, it all depends on the environment also. Let's say it's a windy day that day. Now you can add the trajectory of the wind to it, and this could lead the same droplet to fly more than 10 feet away. And third mode would be self-inoculation of the nasal mucosa by contaminated hands, which explains why you need to wash hands with soap and water after going out or touching any surfaces. And lastly, I want to bring the idea of the eyes. You can get infected via eyes, but eyes have their own protection mechanism because of the tear ducts and so forth. So we don't really need to wear goggles. If you want to, which is your choice, but splashing the eyes with water could be sufficient. So the question becomes, which mask should be worn? So once again, the particle size is what determines the aerosol behavior. And the size of the virus we are dealing with is 0.12 micrometers. I cannot lay enough stress for the clinicians and the healthcare workers who do come in contact with COVID patients or are in the clinic that they should be wearing the N95 masks, because these are the only masks that would filter out 0.1 micrometer particles with 95% efficiency, thus the name N95. For the rest of us who don't really go to clinic or we don't come in contact with patients on a regular basis, but we are going out for running errands, groceries, and so forth, we still need a mask, as I just described the reasons. And right now, there are 2 kinds of masks that are being worn. Less frequently worn is the paper mask or the surgical mask. And this doesn't really filter out the zero point 0.1 micron meters, but it has a complicated network of fibers and the much smaller pores in multiple layers, which makes it a better candidate than the cloth masks. So therefore, it has a better filtering efficiency. But it does not mean that its pore size is smaller, but we can double mask or we can get away because of its complicated network. However, the cloth masks, they have their pore size, the pore size of the fabric is 80 to 500 micron meters. And it has been found that the efficiency of these cloth masks, it drops by 20% after fourth washing and drying cycle. And so there is a change in their pore size and shape and a decrease in microfibers within the pores after washing. So thus, you're going to hate me, but it would be better to double mask to be protected. And this is where the precautions in the right disposal of the mask also comes into picture. As I just explained, that the particle size of the virus determines the aerosol behavior. It means that that our virus, for example, is 0.12 micrometers in size, as I said. And there is a lot of literature out there from the past which states that 5 micrometers or smaller particles in size can remain airborne indefinitely under most indoor conditions. Okay, not outside, but indoors. This means we don't want any of these droplets coming with us inside our living space. Just because we can't see the virus doesn't mean when we went out, we didn't come in contact with somebody who's infected or is a carrier, and the viral particles did not get attached to our mask. So when we come home, a proper disposal method is needed for at least the paper or the surgical mask, which I usually do is wrap it in a bag outside the house, knot the bag, and throw it in the trash can, which is outside the house. So I don't even bring it in. Or if using a cloth mask, then you go straight to the washer, throw it in, and wash it with hot, soapy water. In addition, usually I would also, the clothes that I wear outside, they would go straight in the washer so that they can be washed, so that anything sticking to them. And lastly, one precaution that you could take is when you get home, in addition to doing all this about the masks and then washing your hands with soap and water, you could gargle with warm water and salt. The microbiological reason behind that is that when we have salt on our mucous membrane, it does not let any bacteria or virus sit. It's because even if you got exposed to the virus, this virus needs a little bit of time to get attached to the mucosa and then start doing what it does. So if we are gargling when we come home, it would not get a chance to sit on the mucous membrane and thus cause infection. However, this is not in place of any of the upper precautions that I just mentioned. So I hope this all explains the mystery around the need to wear the mask, follow the social distancing or epidemiological restrictions. As you can see, this is nothing against invading anyone's privacy or rights. It's just plain old simple science to keep us healthy and happy, as it has over all these, I don't know, decades or centuries. You're welcome to write your questions, concerns in the comments, and I would be more than happy to discuss it. If you found all my facts useful, then please like my video. If you would like to continue discussions on health topics and stay informed with true scientific facts, subscribe and click the bell button to be notified when I post a video, which hopefully would be more frequent than I have. And lastly, like I always say, think critically, stay healthy. The Scrutinizer out.